The average person's heart rate is around 80 beats per minute. Imagine if your heart beat twice that fast, 3 times, and once almost 4 times faster than normal. For almost a decade, I dealt with this issue. 2006 is when my many trips to the ER started. And for a third grader, well, it's kind of scary. After 3 or 4 times in the emergency room, they finally figured out that I had supraventricular tachycardia, or easier known as SVT. SVT basically means that my heart would act as a short circuit, so without any kind of warning, it would beat at an abnormally fast pace. When I first started wearing the heart monitors, I did anything I could to hide them. I didn't want the other kids at school to think that there was something wrong with me. A few years later in middle school, I decided to stop hiding the monitors. My heart problem was nothing I had control over, and by then, most of my friends knew about it anyways. When high school came around, I was starting to get sick of going to the emergency room almost once a month. When my heart would race, I no longer would panic, I would just be really annoyed by it. So one night when I was in the ER around 2:30 or 3 in the morning, I started to cry because I was so frustrated with all of this. I just wanted it to stop. So finally I decided to face my fear of having the heart procedure done. In July 2014, my parents took me to the University of Iowa Children's Hospital for the surgery known as a cardiac ablation. Even though I had been in the hospital at least 20 to 25 times before this, I was still terrified. I laid down on the operating table, and after I woke up, the doctor told me that he had froze part of my heart so it wouldn't race anymore. I had to lay down for 8 hours after surgery, and all I remember doing is watching Full House and eating Cheerios. To this day, my heart still beats a little faster than normal, but nowhere near as fast as it used to.